So good afternoon, everyone. It is back to school week post Labor Day, and we have a week of great guests, and this is business as usual. I'm Audrey Russo, President and CEO of the Pittsburgh Technology Council, and I'm joined with Jonathan Kirsting. We've all had a long break, and we're excited to be back. And Jonathan Kirsting is all things media and marketing, and so he will be managing the chat. So I know there are many people that still took a long break, but we are forging ahead at the Tech Council because this is how we kick off September. So I want to thank Huntington, Sheetz, and Comcast for being sponsors. If you don't know anything about them, you really should. Huntington Bank has been long advocates in small businesses and very active in the community on all things civic-minded. They've been great partners with us. Sheetz, if you don't know anything about Sheetz, you really probably should just go to a Sheetz and check them out because they are a serious business who has very committed to reinventing themselves consistently with a strong focus on their customers. They actually have an innovation center right here in Pittsburgh where they're working on the future of Sheetz. We actually had Travis Sheetz on our show a few weeks ago, and you can find that in our archives. And then there's Comcast Business. They've been with us through the journey of trying to address the digital divide, as well as making sure that everyone has Wi-Fi who really needs it. Because guess what? Today marks really the official day of back to school. And we know that there's lots of things going on in terms of back to school, whether it's real in time, in class, whether it's hybrid, or actually, it's, as I refer, students are now, quote unquote, working from home, just like many of the rest of us. So exciting times, and the topic that we're going to talk about today is so timely. And we have our guests today. We have Dr. Susan, and my computer just went off. I don't know if you can hear me.
You're in there, you're all good, keep going.
I'm all good, because I can't see a thing.
Uh-oh.
And my computer just went off. So
Thanks.
I am going to continue to talk, but I'm going to tell you that we have two guests today. And the guests today are going to introduce themselves. So I am going to pass the baton and just let Dr. Susan Manzi, Physician Chairperson at Allegheny Health Network. And next we have Jeff Bernhard. He's the SVP for Commercial Markets at Highmark Health, who has officially moved to Pittsburgh from Houston. So I'd like to start with Dr. Manzi. AHN has been offering some clinical advice to local school districts as they prepare for the plans, right? Today is the day. But before we talk about that, tell us a little bit about your role at AHN, and then tell us about your work with local school districts and why that has been and continues to be an imperative for AHN.
Sure. So first of all, thanks so much for having me be a part of the program. So I am the physician chairperson for our Medicine Institute, which basically oversees all the specialties within internal medicine. But my real reason for being here is because during COVID, Allegheny Health Network was an essential business. We were a hospital healthcare system. We had to stay open, and we had to navigate keeping our employees safe, our patients safe, in a very uncertain time. And through that experience, we gained a tremendous amount of brain trust, quite frankly. The clinicians at AHN, experts from all different aspects of how you have to manage a business during COVID pandemic. And so we decided at the probably somewhere around May or June that we should share that expertise. There were a lot of businesses that were planning to get back to work, the schools trying to get back into the school year. And so we started something called Physician Consultant for Business. And I should say, probably it should say Physician Consultant for Schools as well, because a lot of school districts and universities have been clients of ours. And we're basically bringing a personal physician advisory role into your leadership team within your schools to try to help you manage day-to-day all of the challenges related to COVID. Number one, getting ready to get back to school, but also, as we know, this is likely going to be an 18-month to 2-year ordeal. And so there's going to be ups and downs and new things that get thrown at us. And we're really here to provide some advice and help to you during that time.
It's a lot. It's a lot. And so as you talk to school districts, which you have been doing, what are some of the biggest concerns and questions that they're looking for advice on? Is there any pattern?
Yeah, so, you know, it's interesting. There are definitely patterns, but with a sort of a unique customized twist. For every school has something that's a little different. But first and foremost, they want to know, should they be virtual or should they go in person? Now, some of these, I have to say, some of these decisions are out of our control as physicians and clinicians, because local and state governments have made rules and guidelines for a lot of the schools that they need to abide by. A lot of it depending on the prevalence of COVID at any given time. However, given all of that, the questions they have is, if we're going to be in person, how do we prevent outbreaks? And so we try to help guide them in terms of social distancing. And believe me, if somebody said to me, what are the 3 things you must do,
Mm-hmm.
3 things you must do to try to keep your students safe, it's social distancing, masking, and hand hygiene. Social distancing, masking, and hand hygiene. Everybody goes straight to testing, right? All of the schools want to know how to test.
Right.
We have to test everybody. You can't test your way out of those 3 things, because that's how you prevent spread of the virus, period. So we help them with that, strategies around that. We do bring a lab vendor partner to the table. If they have testing needs, we can try to help them solve for those. But more importantly, when to test, what to do with those results. One of the most important things, and I'm going to say this right out of the gate, because if you don't get anything out of this but this, you have to hear this. People feel that, let's say you have a student or somebody that tests positive.
Mm-hmm.
Now you have to do contact tracing. We'll help you with how you do contact tracing to identify who's at risk, have been around this person. Now, what do you do with those people that have been around somebody that's tested positive? You have to quarantine, right? 14 days of quarantine. Every single school district has asked us, how can they test people to get them out of quarantine sooner? They want to test their way out of 14-day quarantine. Can't do that. Okay, you cannot do that, because this virus has an incubation period, sort of a prodromal period before you may test positive of up to 14 days. So you cannot test out of quarantine, number one. So it's those kinds of questions that we help them with. I think most of all, dealing with testing, dealing with quarantine, dealing with contact tracing, and how to keep kids safe and employees safe.
And so, you know, it's interesting that, you know, the hand washing, right? I mean, so I'm trying to imagine if I was a kindergarten teacher and trying to make sure that I'm having kids keep their distance and et cetera. What about the hand washing? Is it Purell or that kind of thing? Or is it just chronic hand washing? What are you telling me as a teacher?
So the good news, the only good news about this virus, which is highly contagious, is that you can kill it pretty easily. That's good, because there are certain viruses you cannot. So any of the hand sanitizers will kill the bug, as will soap and water. You know, what we tell little kids, that kindergartners, and this, there's different things. You can tell them to sing a song, right? Sing happy birthday for you while they're washing. The other one we tell them is to make bubble gloves. So they get with soap and water and they do it until there's bubbles all over their hands, like little bubble gloves. And then they rinse their hands. So there are little tricks of the trade, but the Purell and the hand sanitizers work just as well.
Okay. And are kids able to keep those masks on?
So there's different ways that you can get around that. So one are masks. The other are the shields. Now the shields have become very popular with some of the kids,
right?
Because they don't feel as confined. They're cute. So some of them will have a little superhero up here. They come down, but the shield has to come around by the ears and it has to come under the chin, right? So you have to protect all these areas. The kids seem to want to wear those, and they feel like they're in, you know, they can talk, they can see the teacher's mouth if the teacher's using them as well. So sometimes that's another option, and they're both effective. They can both be effective if used properly.
Okay. All right. So those are some good examples. I imagine that you'll continue to be busy as the weeks.
Yes.
So let's go over to Jeff. Jeff, welcome to Pittsburgh. I know that you've been here for a year, but now you're officially in Pittsburgh. You're the SVP for commercial markets and Highmark Health. So you serve a lot of local school districts, actually. They're your customers. So schools are heading back, and the normal, you know, back to school supply list has obviously grown, right? I mean, it's not just, you know, the computer, the pencil, the erasers, et cetera. It's now hand sanitizers, disinfectants, and just what Dr. Manzi was talking about in terms of the PPE. Highmark has really stepped up, though, in terms of helping with supplies. So talk about the back to school kits that you've actually offered and how that was launched and how it's working.
Sure. Thanks for having me to the show. Great to be in the Pittsburgh area. So to start with, I would say 90% of the school districts in Western Pennsylvania, we cover their employees. So it's a big population that we've had for a number of years, and we service them. So one of the things that we felt was really important, Susan and I both, I mean, for the folks that don't realize, Highmark Health is a system that owns both a health insurance carrier, Highmark Plan, and also Allegheny Health. So through this integrated network, we're really the second largest integrated network in the country behind Kaiser Permanente. So what that means is that we have expertise on both sides. And when Susan and I, we do a lot of these interviews together, both from the insurer side and the Allegheny side, we realize that as we start to speak to school districts, they really had a big gap in knowledge, and they were anxious to learn about different things they need to do, because one of the things we have is access to expertise, CDC information. We obviously have a lot of clinicians, and we realize we need to provide this information. So part of our mission is to certainly serve the communities that we serve. We decided to donate a number of back to school kits, which I saw, Jonathan, you put in the link, where for all of our customers, we have about 400 different school districts. We provided them a link, and all they had to do was send in their code, and what we would do is mail them out back to school supplies. The back to school supplies included cleaners, hand sanitizers, masks, shields, posters, in addition to all types of information that people could have to help the children and the teachers get back to school. It's not just the children, it's also the faculty that we have to deal with. We also, and help them improve, we also had a seminar. Susan was on it, I was on it, and we had well over 250 different people attend. So in addition to the supplies, we're trying to become a source of information, whether it's trying to figure out how to get school sports back and running, whether it's about how to distance people appropriately on the buses. I mean, there's so many different topics that not only do we have this hour or so session, but we continually get the questions in. So we really serve as that resource, and about 400 different schools took us up with these type of supplies. So we were really happy to partner with schools in that initiative.
So are there some special things for the teachers as well?
Yeah, so obviously, you don't think about this, but it's a big issue. And I think we've all come to realize this. It's hard to hear someone through a mask when they're talking. And a big part of talking is reading lips, right? So the shields allow the teachers to not have the face covered, not be muffled, but have that shield so people can clearly hear them and can clearly see the lips. Because keep in mind, most of your listeners who have grandchildren or children that are attending schools, some are still virtual. So half could be virtual, which means not only do I have a hard time seeing and hearing you, but not reading your lips as you're teaching the class. So the shields, they have that. They have FAQs. They have obviously hand sanitizer. But Susan, you would probably agree, we tend to see the children mostly be asymptomatic, but it's the teachers that will typically have the symptoms, that they tend to be obviously a lot older than the children that are attending the schools.
Mm-hmm. Right, so they might have some pre-existing conditions. Are you seeing, one last thing about equipment, et cetera, in class, in physical, are you seeing like the use of some sort of film or plexiglass where teachers are actually standing behind? Are you seeing any of those things in the classrooms?
I have not seen that, but I can tell you in the cafeterias, they have distanced the food from the people going by, because certainly a child can go by and sneeze or cough, so right. I think they're taking the extra precautions. I have not seen it in the classroom. I do know where my daughter goes to high school, they are, as most people are listening, they're hybrid now, so half go 2 days, half go the other 2 days, and everybody's being spaced out. I think the other thing I'd like Susan to talk about is when you think about a classroom, what are the things that we're recommending to make sure that we get circulation going in the classroom, because it's that stale air that leaves the droplets available for people to catch. Susan?
Yeah, that's a and by the way, Highmark has been such a good partner in all of this. I think together we're a strong team. But the key that I think is important, number one, you space desks apart. So you have to, that's why this sort of hybrid model helps, because you have less people in the building at any given time. And we'll talk about ventilation in a minute, but it's also taking your common spaces and repurposing them. So instead of having 30 kids in one classroom or 20 kids, you can use some of the general spaces that you had not used before and space the kids out into different pods. Mm-hmm. So that's one thing people are doing. Ventilation is a big issue, and it's a hard one for schools. You have schools that have no air conditioning. Right. You have some schools that have all the, bells and whistles, and others that don't. Obviously, if you can keep windows open, you're always better outside. Mm-hmm. Always better outside than you are in a building because of the circulation. Windows open, doors open. The last thing you want to do is put a fan in a room with all the doors and windows closed. You're just circulating viral particles. So there are HVAC systems. The CDC has a very nice guideline online that we send some of the schools to about HVAC systems and what you should be thinking about with air conditioners, et cetera. So I won't go into details, but there are some guidelines there to help. But ventilation is important.
That's good. I'm making note of that on the guidelines. So thank you. Thank you for that. So Dr. Manzi, let's talk about the things that parents can do to help their children in terms of staying healthy during COVID.
Yeah, boy, that's
right? I mean, we know about all of us. So even students who are remote, like they're just home, right, 100% of the time, how are they keeping themselves healthy? They're, they're sitting, they're watching, essentially, interacting with the computer. There has to be anxiety and mental health related issues. And just what about the general, wellness tips that you can share?
So boy, that's so important. It's interesting. As a part of our physician consulting for business, we have behavioral health expertise. So our psychiatry, psychology department, our integrative medicine group. Integrative medicine is just using alternative strategies. So meditation, yoga, those kinds of interventions. Behavioral health, that has been one of the biggest requests we've gotten from the schools, believe it or not. And it's not for the kids. They're more resilient, right? It's their teachers and parents, because the anxiety often is generated there. And so we have put together programs where we can do remote anxiety management strategies for parents. We can do webcasts, we can help employees and teachers, because the best thing you can do as a parent is get your stress level down, because anything you feel, believe me, gets transmitted. The other thing we recommend is a routine. Even though you're home, even though it's virtual, act like it's a school day. Get up at the same time. You have your breakfast time, you have your breaks, you have your snacks, you have your gym time. As much as you can bring that normalcy and routine in, the much better you're going to be. And when that school day is done, the school day is done. They get their break period, they do their homework. I know it's easier said than done, believe me, especially if you've got 5 kids or 3 kids that you're trying to do this with. I admire parents that are doing that, believe me. But these are little tips, and again, we could provide more advice on that to customize to your needs.
Well, I mean, sports and physical activity are a critical part of education, right? Not just the ability
Yes.
to play and the teamwork and all the things that come out of that, but actually, the release of energy and activity. So what about sports in schools?
So obviously you see some people making decisions to go forward and others deciding not. A lot of that, again, has to do with prevalence. What's the baseline prevalence or frequency, right, of positive tests on your team, in your area, and you have to keep track of that. It's very hard to do. Again, it's easier said than done, but those people on that team, when they sign on to that team, they're signing on to behaviors when they leave that field or that team, right? If and that's a part of it. And the coaches have to be very strict with that, because they cannot go out and be careless and bring things back to that team. If they can keep that team from doing foolish things outside, then the risks go way down, right? And there are things, and a lot of these sports are outside. That's a plus. That is a plus. So there are ways of getting around it. And if your kids can't play team sports, get them outside and have them walk or run or ride their bikes. Those things are safe.
Okay. And I do understand that playing percussion instruments as well as singing,
yes,
not recommended.
Not great, not great, because again, this virus is transmitted by droplets, and droplets come from your mouth, and when you speak, these droplets. So if you can imagine blowing into an instrument, or we're all over the place, right? Or singing, you've got all these droplets. So those, if you were going to really cut back on anything, those would be the things you would really want to do. Is try to avoid that. One other point I want to make is people talk about the eyes, because the virus can get into any mucous membrane, right? So the shield protects your eyes, which is one of the reasons we like the shields. But if not, even your glasses may help. Or people that wear goggles, you'll see people wearing goggles on planes, etc. That's just an extra precaution that can help as well.
Okay, that's great. So I'm going to jump back to Jeff. And, you're receiving requests that are probably beyond your ability to fulfill. Is that right? Or am I just jumping there?
It's interesting. It's a good question. I think that yes and no. So I think that what we're finding is that people want information more than anything. They don't really want us to tell them how to run their school and all that. We provided the supplies and so forth, but I think the best that we can do is be a resource to the communities that we serve. So in Pennsylvania, Delaware, and West Virginia, we're doing that. And it's not just for schools. Let's keep in mind, we I don't know, Susan, we have 50,000 employees or so in those 3 states. So we have to practice the same guidelines. So if we're going to be going through this and we have access to the expertise, we try as best we can to share the information with the public and what they can do. The number one question right now from employers is, how can I safely reopen? So again, we have a website that Jonathan, at the recording, you can probably, we'll get it for you. You can put in the link here. So I think the number one thing is to be a resource. And as we get information, we'll continue to share it with the employers. That's what people are really looking for is, I don't know what to believe when I listen to the media, when I read articles. We're just going to share what we're doing, given the resources that we have and the information we have access to.
But in terms of fulfillment of some of the things that you're actually providing, so in terms of the supply chain, are there any ways that actually the members of the tech community and our membership can be additive to your efforts? I'm just throwing that out there, that maybe.
Yeah, I certainly think so. I mean, I think in sharing of information, that can probably be the most helpful. And at this point in time, we've been able to successfully fulfill supplies and so forth. And by the way, we do that for our clients. So we're not, setting up shop at the convention center or anything like that for the community. It's mainly for clients. But I think where you can help is sharing information and passing on the information that we have to your clients and their clients and so forth.
Right.
It's because things change pretty quickly. I mean, the biggest thing right now is vaccine, right?
Right.
How do you know who to believe? Are we going to have something? It's been a little bit politicized. So is it going to be in 6 months, 9 months? How safe is it going to be?
Mm-hmm.
I think, Susan, the last poll I saw was that 40% of the people would even consider taking the vaccine, and then you need it twice. So I think that's going to be the latest and greatest information that we share. So if you can be a conduit to help share that, that would be great.
All right.
I agree with that. And if I can just add one thing, because I agree. I think what's been tough is there's been a lot of information flooding the media. So it's not that there's a lack of information, it's somebody that can interpret it for you, right? Decipher it, put a scientific lens on it and give you something that's actionable. That's the hard part, because you get all this conflicting information hitting you. Some of it's hype, some of it's real, some of it's we're learning. So that if we can come together as a community in Pittsburgh, and by the way, Pittsburgh's done really well for COVID, and they get shout outs all the time. But if we can come together as a community, Highmark, AHN, and be that conduit to sift out the nonsense and give you what is real and at least the best evidence possible and something you can act on, that's a real value.
And so as we wrap up, and before I thank you for the time and the information that you've shared, Dr. Manzi, what's your prediction? What do you think over the next, we just finished 6 months, right? We're almost next week or this week, it'll be 6 months, 2 full seasons. What's your prediction? What do you predict?
I guess, my advice is don't let your guard down, because there's a fatigue, right, that's going on. This fatigue, like, hey, we kind of got out of this pretty well. Let's let our guard down a little bit. Let's kind of go out and do our thing. And I say, do not do that, because the virus is still here. There is no vaccine. And by the way, we're coming into flu season, right? That's when viruses really take off. You've got flu out there, you've got COVID. So please keep up all the things that you're doing. I know it seems like it's forever, but to me, this is going to be an 18-month to 2-year endeavor, or until a really good vaccine is available. So brace yourselves. We can get through it, but be very vigilant.
So when you say vigilant and when you say brace yourself, and I think you're absolutely right about COVID fatigue, what does that mean? That we should limit our travel, that we should continue to be behaving the way that we should have been and continue to have been in Pittsburgh for the last 6 months?
Well, it's a great, what I could give you my opinion, and then I could give you what the general messaging has been, because as you know, airlines have ramped up. There's a lot more people traveling. My feeling is travel carefully, right? If you don't have to get on a plane and travel, if you don't have to put yourself in that position, don't do it, right? It's a little sacrifice to be made for somebody you might expose to a virus that could kill them. We're not talking minor little cold for some very, vulnerable people. So I would say limit your travel. If you do have to travel, you got to do it with your masks, your hand sanitizers, your wiping down of the seats around you. Take, what I say, nonstop flights if you have to. Anything you can do to be smart.
Okay. Do you think, and then one last thing for you, Dr. Manzi, do you think that with these good hygiene practices that we've been doing over the last 6 months, I mean, I don't know about the people who are listening, but I'm like a really good hand washer now.
Yes.
And
Bubble glove.
I'm pretty compulsive about it, where I could tell you in all my years before, I probably wasn't as great. Do you think that will help offset the flu season?
Absolutely. I always say there's good things that come out of these crises, right? The one is that maybe more people will get their flu vaccine, maybe, this year. The second is that practice alone, being aware of people around you, who's coughing on you, how are you washing your hands. You may see flu numbers go way down, which would be terrific on top of all this. So there'll be good that comes of it, for sure.
So thank you both. Jeff, is there anything that you want to wrap up and say before we close out?
No, I just wanted to say from a business perspective, I think to your point on hand washing, I think that for all of us, including Highmark, I think here's an opportunity that forced us to adapt in thinking about how we conduct business. And I think we're going to be stronger as a nation, all companies, all people, after we've been through it. It's going to be a tough ride, but the adaptation that we have and that we evolve from will be a better will be better companies, better people, and so forth. So not everything is negative. I think that's definitely a silver lining from a business standpoint as we move forward.
So thank you. So Susan, there's one last question. Carol Pan, she asked about, will all these cleaning measures, excessive hand washing, breed superbugs, or is that not a real concern?
No, antibiotics breed superbugs.
Okay.
This hand can only help you.
Okay, so power to hand washing, power to Highmark. And thank you, Jeff Bernhard.
Yes,
thank you, Susan Manzi. Thank you, Jonathan, for being here. And thank you, everyone. Tomorrow we have Near Earth Autonomy. And the founders are joining us, and you really won't want to miss it. They've been making some news lately, and we're pretty excited to have them join and talk about the work that they're doing in autonomy. So thanks again to everyone. Have a great day. Wash your hands. Stay safe. And thank you, Jeff and Dr. Manzi.
Thank you all.
Bye-bye.
Bye-bye.